NCSBN NCLEX Review Questions with Answer Key Full Test. Question 1. Information about case management and the role of the case management nurse is presented during an orientation session for new nurses. Which statement correctly describes an important fact about case management? Option A. Case management strategies focus mainly on the client's needs after discharge. Option B. Case management is a collaborative process designed to meet complex client needs. Option C. Physicians are responsible and accountable for client outcomes. Option D. The interdisciplinary team makes all the decisions for the client and family. The correct answer is option B. Case management is a collaborative process designed to meet complex client needs. 2. Question 2. During the management of a client's pain, the nurse should adhere to the Code of Ethics for Nurses. Which of these actions should the nurse consider first when treating the client's pain? Option A. Cultural sensitivity is fundamental to client-centered pain management. Option B. Clients have the right to have their pain managed promptly. Option C. Nurses should not judge a client's pain based on the nurse's values. Option D. The client's self-report of pain is the most important consideration. The correct answer is option D. The client's self-report of pain is the most important consideration. 4. Question 3. A client with a musculoskeletal disorder has been newly fitted with a lower limb orthotic. Which activity can the nurse delegate to the Certified Nursing Assistant, CNA? Option A. Provide instruction to the client for ambulation with the orthotic. Option B. Monitor the client's response to moving with the orthotic. Option C. Check the client's skin for any redness or irritation from the orthotic. Option D. Assist with transferring the client from the bed to the chair. The correct answer is option D. Assist with transferring the client from the bed to the chair. 4. Question 4. Upon completing a review of a 27-year-old client's admission documents, the nurse identifies that the client does not have an advance directives. What action should the nurse take? Option A. Lecture the client on the importance of having advance directives. Option B. Inform the charge nurse to offer information about advance directives. Option C. Advance directives are not appropriate for this client due to the client's age. Option D. Refer this issue to the client's healthcare provider. The correct answer is option B. Inform the charge nurse to offer information about advance directives. 2. Question 5. The home health nurse is visiting a client diagnosed with type 1 diabetes and osteoarthritis. The client has difficulty holding and using the prescribed insulin pen. The nurse should refer the client to which community resource person? Option A. Physical therapist. Option B. Pharmacist. Option C. Physical therapist. Option D. Occupational therapist. The correct answer is option D. Occupational therapist. For holding and using an insulin pen requires fine motor skills and good vision. A client with osteoarthritis, OA, might experience limited movement and pain in the joints of the fingers and hand. An occupational therapist can help a client improve the fine motor skills needed to prepare an insulin injection. An occupational therapist works with clients to perform tasks that are needed for smaller movements to maintain activities of daily living or for work. Question 6. A client diagnosed with schizophrenia insists that the nurse explain the use and side effects of the medications prescribed for the client. What should the nurse understand before responding to the client? Option A. The psychiatrist will need to grant permission to discuss the client's medications. Option B. All clients have a right to be informed about their prescribed medications. Option C. A decision to reinforce or not reinforce information about medications should be made by the nurse alone. Option D. It is too dangerous for clients who are diagnosed with schizophrenia to know about their medications. The correct answer is option B. All clients have a right to be informed about their prescribed medications. 2. Question 7. The nurse asks another staff nurse to sign for wasting a partial dose opioid injection, although the wasting was not witnessed by anyone. This type of request seems to be a pattern of behavior for this nurse. What is the most appropriate action for the second staff nurse to take? Option A. Report this request immediately to the nurse manager. Option B. Review the client's medication administration record, MAR, for past wastes. Option C. Ask the nurse's client if they witnessed the waste of the partial dose. Option D. Confront the nurse about suspected narcotics diversion. The correct answer is option A. Report this request immediately to the nurse manager. 1. Question 8. A client diagnosed with bipolar disorder has been referred to social services for possible placement in a community halfway house after discharge. The social worker telephones the nurse and asks for information about the client's mental status and adjustment. What should the nurse do next to respond to this request? Option A. Go ahead and provide the information, since the client is ready for discharge. Option B. Inform the caller that this kind of information is never given over the telephone. Option C. Refer the social worker to the healthcare provider to obtain the requested information. Option D. Verify that the client's medical record includes the client's written consent to release information. The correct answer is option D. Verify that the client's medical record includes the client's written consent to release information. 4. Question 9. During a discussion about a living will, the client's son states, "I do not understand the need for a living will." What is the best response by the nurse? Option A. Healthcare decisions can be made based on the client's wishes. Option B. Specific instructions are listed for specific diseases. Option C. A designated family member can make all decisions. Option D. Do not resuscitate, DNR, orders are automatic under these conditions. The correct answer is option A. Healthcare decisions can be made based on the client's wishes. 1. Question 10. The client requests not to be interrupted before 10 a.m. because it interferes with the client's time to meditate. What action shall the nurse take first? Option A. Document the client's request in the medical record. Option B. Meet with the client to formulate a mutually agreeable schedule. Option C. Notify the dietary department about the client's request. Option D. Adjust administration times for prescribed medications. The correct answer is option B. Meet with the client to formulate a mutually agreeable schedule. 2. Question 11. A client who recently experienced a stroke has an order to ambulate with assistance. Which statement by the nurse provides the best instructions to the unlicensed assistive person, UAP, who will assist the client to ambulate? Option A. Have the client lift and move the walker out to arm's length, then walk into the walker. Option B. If the client becomes dizzy while walking, ask the client to stop and take 10 fast, deep breaths. Option C. As you assist the client to the chair, let me know if the client uses the quad cane correctly. Option D. Stand on the client's strong side when you assist the client to the bathroom. The correct answer is option A. Have the client lift and move the walker out to arm's length, then walk into the walker. 1. The person assisting the client to ambulate should walk on the client's weak side, not strong, side. Question 12. The nurse is reviewing information about the healthcare organization's efforts to improve quality of care. Which of these statements best describes the goal of continuous quality improvement, CQI, in a healthcare setting? Option A. Perform actions based on reactive problem solving. Option B. Create a flow chart of department or staff interactions. Option C. Conduct chart audits for common error discovery. Option D. Improve the quality of care in a proactive manner. The correct answer is option D. Improve the quality of care in a proactive manner. 4. Question 13. The client is admitted with a diagnosis of hyperglycemia and poor glycemic control. Which task can the nurse assign to an unlicensed assistive person, UAP? Option A. Check sensation in the extremities. Option B. Observe for mental status changes every 4 hours. Option C. Reinforce findings of hypoglycemia when the client asks. Option D. Measure blood pressure, pulse and respirations. The correct answer is option D. Measure blood pressure, pulse and respirations. 4. Question 14. When walking past a client's room, the nurse hears an unlicensed assistive person, UAP, talking to another UAP. Which of these statements requires further intervention by the nurse? Option A. I'll come back and make the bed after I go to the lab. Option B. If we work together we can get all of the client care completed. Option C. Since I am late for lunch, would you perform my client's blood glucose test? Option D. This client seems confused, we need to watch the client closely. The correct answer is option C. Since I am late for lunch, would you perform my client's blood glucose test? 3. Question 15. The nurse has been assigned to 4 clients. Which client should the nurse see first? Option A. The client with a history of coronary artery disease, CAD, reporting dyspnea, nausea and unusual discomfort in the upper back. Option B. The client diagnosed with peripheral artery disease, PAD, who reports cramp-like pains in both calf muscles following physical therapy. Option C. The client with a history of heart failure, HF, who reports going to the bathroom too much after taking a diuretic. Option D. The client diagnosed with hypertension whose last recorded blood pressure, BP, was 180/90 after returning from the radiology department. The correct answer is option A. The client with a history of coronary artery disease, CAD, reporting dyspnea, nausea and unusual discomfort in the upper back. 1. Question 16. The licensed practical nurse, LPN, is reassigned to work on an acute care unit. Which of these clients would be most appropriate for the LPN to accept? Option A. A trauma victim with multiple lacerations requiring complex dressings. Option B. An older adult client diagnosed with cystitis who has an indwelling urethral catheter. Option C. A confused client whose family complains about the nursing care given after the client's surgery. Option D. A client, admitted for a possible stroke, with unstable neurological findings. The correct answer is option B. An older adult client diagnosed with cystitis who has an indwelling urethral catheter. 2. Question 17. A nurse must use an interpreter to collect data from a client. Which action should the nurse take to help communicate with the client? Option A. Include a family member and direct comments to that person. Option B. Talk to the interpreter in advance and leave the client and interpreter alone for discussion. Option C. Speak directly to the interpreter while asking questions. Option D. Face the client while asking questions as the interpreter translates the information. The correct answer is option D. Face the client while asking questions as the interpreter translates the information. 4.